yes, there's something I missed, but because people are going to walk through here all the time.
Yes, exactly. There was no alcohol.
No, it's fine. We can do it. Yeah. Just pack it in and then I'll talk with this.
Good morning, everybody. I'm happy to welcome you to this next session, which is titled How to Capture Accessibility Benefits in Transportation Policy and Planning. And some of the topics that we want to discuss today is really how to put accessibility in the center of these decisions, both in planning but also with respect to investment. We know that good accessibility is a strategic goal, and already it comes with direct benefits related to sustainability, decarbonization, more livable cities, so we will also talk about those topics as well. And we're going to be asking the panelists a lot of questions today on what needs to be done. What actions do we need to take to make sure that accessibility is a central criteria in these decisions? We will also discuss a little bit about how these access guarantees within transportation policy and planning fit to the strategic goals of the governments. And lastly, what are those interlinkages between accessibility and decarbonization or sustainability and livable cities? So just a little bit about the session. We will start by bringing up our panelists and experts. We will do an introduction round where we're defining what accessibility means from their viewpoint. This will be about a 40-minute moderated Q&A, and then we will have an intervention from Henk Stipdank from the Netherlands Institute of Transport Policy Analysis, and then we will do a wrap-up with Q&A with the audience and a summary. So with that, I'd like to introduce our panelists today. So we have Heather Thompson, She's the CEO at the Institute for Transportation and Development Policy. We have Daniel Kim. He's the CEO of AutoCrypt. I'd like to welcome Anne Fry. She's the director at Anne Fry Limited. And Tim Shearman, the deputy president of the FIA. And we will now jump into the discussion. So thank you all for being here today. We will start maybe with you, Heather, if you want to just introduce yourself, your organization, and also from your standpoint, how you define accessibility.
Sure. Well, good morning. I hope by the end of the session we have a full room because I think we have a lot of great things to share with you all. It's a pleasure to be here. My name is Heather Thompson again, and I'm the CEO of ITDP, which is the Institute for Transportation and Development Policy. We are an international nonprofit organization headquartered in New York, which is where I'm based, but we have offices all over the world, predominantly in the global south. So Mexico, Brazil, China, India, throughout Africa, Indonesia, really covering all areas of the world. And our mission is to help predominantly cities plan transportation systems that are equitable and sustainable. We work on both projects, helping development banks and cities develop infrastructure projects, as well as developing policies. And again, we work mostly at the city level, the local level, but we also work at the state, national, and international, where policies and funding decisions happen and trying to influence those. And in terms of accessibility, one of our main foci is really looking at making sure that systems are accessible for people in low-income countries, low and middle-income countries, but also really making sure that systems work for everyone, everyone with any sort of special needs. So maybe I'll leave it at that, and we can get into the discussion further.
Okay, I'm Daniel, working at AutoCrypt as a CEO. I'm glad to meet you today. So AutoCrypt is a cybersecurity company for automotive industry. We're providing several cybersecurity solutions for OEMs or tier 1 companies, and we are very familiar to the data related to the vehicles or transportations. So we have a lot of interest in the transportation services also. Actually, AutoCrypt has our own booth on this floor. If you have interest in my company, you can visit our booth. You can get more detailed explanations about our company. Accessibility is a very important, very hard issues, but in my opinions, understanding the customer's requirement is always very important to make a business. So accessibility can be interpreted as the amount of requirement for better transportation services in the opposite way. Usually, lower accessibility can mean the higher user potentials and more business opportunities. Of course, in some cases, the lower accessibility would be just a result of low necessity for transportation. So we need to collect the data, and also we need to analyze and interpret and test our interpretations. In some other aspects, the accessibility can be defined as the safety itself. If some travel routes are not safe, people do not prefer to the roads, to that route. And if some transport methods have higher accidental possibility, those methods cannot be preferred at all by people, especially the people with disabilities. So actually, what got AutoCrypt initially to the accessibility issues is vehicle-related data. Our business, we started out as a cybersecurity company for automotive industry, and one of our core business area is collecting and analyzing the data. So by real-time transport data, we provide the efficient ways for mobility operators to improve their services and operations. During this process, we noticed the tremendous potentials of our real-time data sharing. So this process will improve the mobility services itself and accessibilities also.
Good morning. I'm Anne Fry. I'm a one-woman business. I've worked for more than 30 years in the field of mobility for disabled and older people, both in government in the UK and internationally with the ITF, with the FIA and others. My current roles include, I'm the UK government's ambassador for accessibility at airports. I chair the Accessibility Forum at London Gatwick Airport. But I'm also working on a big new European project, Accessible EU, which is building a centre of excellence for best practice in delivering accessibility for people with disabilities across Europe. I'm the senior transport expert for that. So my focus is very much on developing policy that recognises the needs of people with disabilities, making sure that their needs are not overlooked as we stampede towards the green agenda, but also working with low-income countries, trying to help them to make a start with accessibility. When you have no money and no accessible infrastructure, what can you do to make small steps towards improvement? So it's a very wide field. We have a global aging population, a very strong link between age and disability. And mobility is absolutely fundamental to people's ability to live independent lives. So that's what I do. Thank you.
Hi, my name is Tim Shearman. I'm the Deputy President for Mobility for the Fédération Internationale d'Automobile. FIA is a federation of over 240 clubs around the world. You may know FIA from its first pillar, which is motorsport, governing body for Formula One, as an example. But we have probably, in terms of numbers, greater representation on the mobility side of the ledger. We have over 80 million members represented in our member mobility clubs. In my regular, I call it my day job, I'm the CEO of the Canadian Automobile Association, and we're a federation of 8 clubs that has 7 million members. So, you know, I sort of work on the day-to-day business with CAA and then on the governance side with FIA. And our goals are the same. We want safe, affordable mobility for all. Even though we have automobile in our name, we know our members don't just use the automobile. They ride their bikes, they take rapid transit, they walk. And we need to have safe, secure mobility for all those people. We want to ensure that no one's left behind, whether they be young, or elderly, or disabled. We want all of our members and all of the populations to be have access to safe, affordable transportation and mobility. And our goals are to work with the various, being a global federation, we see challenges in all corners of the world, and they may be different. And what we try to do is help each of our member clubs with their mobility concerns. And it's great to be here today with such a great group of panelists. I think looking forward to the dialogue today and learning a lot. So it's a pleasure to be here, and thank you.
Super, thank you, Tim. Okay, I'm going to start with the first question to Heather. So equity and accessibility implies that there is access for all groups of transportation users. In your experience, what groups have been underserved or maybe not even served at all?
Well, unfortunately, I think that's a quite long list. I think too often we forget that the fundamental goal of transportation is accessibility. It's about getting people to places, whether it be jobs or schools or healthcare. And too often, really rarely do we actually measure accessibility. We more often measure mobility. And most often that is mobility of cars, of vehicles, which is often a small portion of the population. And it's about, how fast can a car get from A to B? And that may or may not actually look at how much accessibility that provides. Often roads are built with ideas that don't actually measure the access to places. Never mind looking at the needs of other people, which often most people can't afford a private vehicle. So when you're really thinking about the needs of most people, we need to prioritize public transportation, walking, cycling, making sure that all of those modes are actually accessible, and also that the investments in those modes, again, increase our access to the things that people need. Public transportation in particular, metros often are built along areas that serve commuter passengers, often men, going from their homes to downtown areas for commute trips, where actually the majority of public transportation users are not men on commutes. They're often women, caregivers, people with disabilities, the elderly, many other people, and we don't actually look at their needs, and we aren't often actually measuring, do these systems that we're building provide greater access? Are they in the locations where we're actually going from where these people live to the destinations that they need? So we need to really start thinking more carefully about measuring access. And we can get a little bit more into that because I think a lot of that has to do with data and tools and some of the other things that we'll talk about here today.
Thank you. So in summary, it seems as if all groups besides male commuters we need to work on. I want to switch over to Anne because and accessibility is often seen to start with physical access to transportation infrastructure. What, in your opinion, is missing in your work, is missing with that mindset of just focusing on the transportation infrastructure in the first step?
That's absolutely right what you say, that in many people's minds, accessibility for disabled people means wheelchairs. We'll put on a ramp, we'll put on a lift, and we've solved the problem. People in wheelchairs, of course, accessibility for them is hugely important, but they are a tiny part of the population of people with disabilities. We have an enormous range of people with sight loss, with low vision, with hearing impairment, and increasingly we're aware of people with mental health issues, neurodiverse issues, which are not visible. So to the transport provider, they just look like part of the mass of people. But there are many things in the way that we design and operate transport that actually prevent many people from traveling. Just to give you my pet hate, which is duty-free areas in airports, which are designed to persuade you want to buy whiskey at 8 o'clock in the morning. They have bright lights, strong perfume, zigzag walkways, shiny floors. All these things, I think, frankly, annoy all of us. But if you are somebody with autism or any other neurodiverse condition, they can be absolutely traumatic to the extent that some airports now have to provide a separate route for people who cannot cope with duty-free to get round by a back way. Now, that to me is absolutely crazy. That is not inclusion. So if we're thinking about accessibility, part of the trouble is the universal wheelchair symbol is used across the piece to symbolize everything to do with disability. But we really need to focus and to make sure that transport planners, manufacturers, providers also understand that disability is a very wide spectrum and that wheelchair access is one vital but one small part of that whole equation. Thank you.
Thank you, Anne. Daniel, I want to kind of come to you now as a response and connection also with what Heather said as well. What role does data play in being able to better plan and map the needs from the users with what should be implemented for accessibility and mobility?
Okay. Accessibility means fulfilling the individual need using the right transport options. But actually, it's not easy as it sounds. So from the financial standpoint, to achieve the sustainability, we must focus on the operations efficiencies. So for this efficiency, we need to collect the data, transport data from the vehicles or transportation services or other transport infrastructures. Sometimes we need to collect the information about the EV charging systems also. So this collecting the data, analyzing data, we improve the efficiency and operations effectiveness. So in the cases, we sometimes in our mobility services, we use our own data and data from other partners or infrastructure controlled by government agencies. So we need to integrate the whole data to create the new common patterns and understand the situations in transportation systems. So this process, we can provide the more valuable and more efficient and convenient transportation services, mobility services. So it is the collecting and analyzing data is very powerful to improve our mobility services. However, we need to consider another point. Usually, collecting data has some privacy issues. So, for example, imagine there are some monitoring devices like the CCTV camera in intersection to monitor the traffic flow and road users. But with this device mount, we can collect the information, valuable information about where the road users are and estimate the possibility of car accidents. But we can know who they are and where some people are at a specific time, where they are. So this privacy problem can be very big problems to improve our mobility services and transport systems based on the data-driven technologies. So these privacy problems sometimes can be solved easily. For example, in the previous example, we can add some functionalities to masking the images of detected persons, and also instead of the CCTV camera, we can use the LiDAR or radar-based monitoring systems with similar functions and without the privacy issues.
This on? Thank you. Just to come back, though, also to making sure that you're collecting data on those users that maybe are underrepresented, because if you think about some of the use cases that Anne mentioned and Heather already, if we're forced somehow to use what's out there today, so how do you actually know what my real need is? Is there a way with data to capture some of those underrepresented voices with respect to what they actually need?
The most common ways to collect some information about that is to tracking the similar users' behaviors, to track the history of the other user patterns. So this analysis, we can understand the common patterns and travel routines and the popular starting point and destination point. Yeah.
Okay, perfect. I want to move to Tim. Tim, so cost is sometimes an impediment to accessibility. How do you think affordability should be included into this discussion around accessibility?
Yeah, that's a great question. Cost, of course, is probably one of the primary concerns about giving people equal access to mobility. We've all seen examples of parts of the world where typically the women may have to travel miles and miles every day just to get water. And that is a huge cost for individual cost and time and whatnot. And we in sort of Europe and North America, we've been focusing a lot on things like EVs and sort of modern forms of transportation, but that's not the whole world. There's a lot of different examples of costs coming into play. In our world, though, we have done a number of studies on this field. For example, the club in Netherlands, ANWB, they've been piloting drones to transport medical services and to people, again, to reduce the cost because you're taking the medical, like the drugs, or in one example in Northern Africa, they actually transport blood through drones, and that improves accessibility because you're not forcing people to come to the product; you're delivering the product to them. We have our club in Catalonia, RACC, in Spain. They've developed a mobility as a service app, so they allow people to get accessibility to various forms of mobility within, Barcelona, for example, whether it be by bike or by car or by train. And again, and people can track the cost of those, the different forms of transportation on the app, so they can get to their destination safely in the most cost-effective way. So there's a lot of examples of clubs within our family at FIA that are looking at accessibility and the costs associated with it. I know in our club in Canada, we recently did a study. We surveyed 16,000 EV owners. It's sort of the biggest study that's been done in North America so far, looking at the future of EVs, the future of that form of mobility. But to be honest, we haven't done a great job of tracking accessibility when we do these studies. We tend to follow the standard questions, and to Anne's point, we're maybe, we kind of ignore the broader accessibility issue. We focus on, the wheelchair and maybe people that have physical mobility issues, but not maybe the mental mobility issues, or whether they have hearing issues or sight problems. So we can all do a better job of that. But I think we're attuned to the challenges, and I think we've worked actually with Anne on a website for disability. I think I have 60 countries represented in the website, where we try to track with these countries the standard policies around disabilities. But we were chatting before this session. The data is always lacking. We don't have the most up-to-date data, and we don't get the data necessarily from the governments in each case because they don't even have the right data. We have to go to different bodies within those countries to get the data. So in order to make transportation and mobility more cost-effective, we need data. We need access to all forms of transportation, to make it more practical and more relevant.
Maybe just a question back to you and Anne, because you mentioned essentially sort of the complexity of all the different needs that need to be considered besides just the physical needs. But then also, Tim, you alluded to this whole international community and the different needs in the different regions and the different income levels and things that might. How do you manage the complexity and Anne, especially to you, with capturing all those different types of needs. You know, what's on the questionnaire, or what should be on the questionnaire, and how do you try to find solutions that can be replicated across different similar countries or regions?
Well, I think the first answer is don't put out a questionnaire because you will miss most of the people you're aiming at. Just to give one example where initiatives like shared space in cities have been introduced, there's always a survey done afterwards of the people out on the street, and they say, yes, it's great, I love it. What nobody thinks about is the people who are not out on the street because they're too frightened to be there, because this mix of vehicles and pedestrians that rely on making eye contact simply excludes them. So a point that I always make is you need to listen to the silent voices. At the moment, we listen to the loudest voices that tell us that, you know, cyclists need better facilities. Yes, of course they do. But then a lot of older and disabled people are too frightened to come out because of fear of being knocked over by a bike or an e-scooter or whatever it might be. So if we want to find out what people's needs are, we really need to drill down and talk to people in their homes, through their healthcare, through their communities, absolutely not just online. We need to remember that a very large proportion of older people don't have access to the internet. They certainly don't use apps. Many, many older people are frightened of giving financial data, of buying tickets or anything of that sort online. So if we get too focused on apps as the way to book trips, to organize things, to find things out, we're excluding a very large proportion of people. And I think it's easy to say, well, you know, present generation of older people, they'll soon be gone and it'll all be great. No, it won't, because each of us, when we get to that age, will find that technology has left us behind, that we can't keep up either. So we always need to remember that we have to communicate face-to-face, we have to communicate in detail at the local level to really understand what people need. Thank you.
Tim, do you want to say anything about how you can do that at the international level? Is this feasible?
Well, yes, it's difficult, but you know, it's a matter of listening and to Anne's point, asking the right questions or getting the right input, because we can't as Anne said, you can't pick what are the 10 questions we need to ask people, because you're going to miss most people, because you know 80% of the population is probably in one sort of bucket, and then you have the obvious maybe disabilities that you know probably are 5%, and I'm just making these numbers up, but there's a huge scale that you can't reach. So what we do is in FIA we have 4 regional bodies, the Americas, North America and the Caribbean being one, South America being the other, Europe and Africa, ironically, it's a big region being another, and then Asia Pacific. So we have outreach into each of those 4 regions, so at least we get a bit more granularity in the information we get. And of course, within those regions, we have multiple clubs. So it's a matter of drilling down and looking at the different needs. I mean, I talked earlier about EVs, you know, and that sort of being a way for, and maybe beyond that, autonomous driving. When we think this is going to be a cure, everyone's going to be able to get it, regardless of their disability. They're going to be able to get in this vehicle, and it's going to take them wherever they want to go, and they'll get there safely, and they won't be afraid to go because the car will look after them. Well, that's great in maybe the top 1% of the economies in the world, but you know, I've been fortunate to travel to other parts of the world where EVs are decades off. I mean, people are traveling on busy roads with scooters. If they're lucky, they have a scooter. If not, they're trying to navigate by walking. And to reach that demographic and those individuals takes a different focus. You can't talk about autonomous driving as being the panacea for safety. So, I mean, it is a challenge, and we have to listen to all of our members and all the people that require mobility to make a living, to buy their food, to get their water. And there's no, unfortunately, there's not one solution. It's just a matter of adapting to each market as best we can.
Heather, let me ask you to weigh in here. How are you trying to capture those voices?
At ITDP, one of the things that we're most proud of is that all of our offices are really run by locals. I think if you want decisions that really make sense for a place, you have to base it on those people. Decisions need to be made by those people. So I think there's a couple of ways of going about that. I mean, we've talked a lot about looking at data. And so one is, trying to find ways of collecting data, but also disaggregating data. Often we look at data as a whole bunch, and we don't actually disaggregate it by needs, which is not easy, but at least it is getting easier. But separating it to look at what are the specific patterns of women, what are the specific patterns of the elderly, people with disabilities, and recognizing that those patterns for everyone are a bit different, but there are some commonalities, some of which have already been mentioned. For example, women often are making short trips that are chained. They're taking their kids to school. They might be caring for elderly, and I say women, but really meaning caregivers. Caregivers are often, most often women, but really all caregivers, again, might be taking their kids to school in the morning, taking care of the elderly, going to the grocery store. So they are making smaller chained trips, which might involve walking and public transportation, smaller trips, having often to pay multiple fares that can get expensive. So if you really think about that particular user group, you find a completely different pattern than you might for others. Or thinking about the elderly, again, not every person is the same, but often the elderly might prefer to take a bus rather than the metro. It's more accessible. They definitely prefer, walking over cycling. So really looking at those patterns using data. Another thing that we do is that decision makers are often not only not looking at data, but they have a particular idea in mind, which is really serving the needs of private car owners, and they're really just not even understanding the needs of others. So as Anne and Tim have said, it's really important to talk to people, to try and bring out the voices that aren't being heard. But I think another thing that we really try and do is to put the decision makers in that role as much as possible. So we take decision makers out and we put them in a wheelchair and ask them to try and get up a ramp to the metro. We will blindfold them for a while and try and get them to get on a bus or walk down the street so they can actually experience what it's like. We also do things that are maybe a little bit strange, but we've done something called the stiletto test, where we actually try and have men put on stilettos and push a baby carriage down the street and try and think about boarding public transportation that way. And with that experience, we've been able to change minds to really think about not only the forms of transportation that we're investing in, but also the connectivity between the transportation systems. Often that's the thing that's completely forgotten. Countries, cities will spend millions of dollars, hundreds of millions of dollars on a metro system and then wonder why it's not being used. And it's because it's not accessible. There's no way to safely walk there or cycle there, especially if you have any of these sort of special needs. So not only thinking about the design of the systems, but the connectivity of the systems and all of that other supportive tissue.
I want to just stay with you for a minute, because what we've talked a little bit about so far is, what's missing? What do we need to do? But now you're leading a policy institute. How do you now make that into action? Like, how can you force it? Is it incentives? Is it, or law, right? How do you make this now?
Yeah, I mean, I think it is about policy. It's about, really requiring that those that are in the decision maker's shoes are spending money on the right things and are planning the systems the way they should be. So it's about policy to require systems to truly be planned universally, which then, breaks down into how are budgets being allocated? Are they actually being allocated to support public transportation, walking, cycling, connectivity? Is there funding allocated to actually do this sort of outreach to people to understand their needs? Is there budget allocated to actually invest in data systems that allow us to have more information? And then really, it's policies about not putting the car first, not investing just in roads, but having allocations that prioritize public transportation, walking and cycling, and these connectivities. So it starts with policy, but it often comes down to really, money matters. You have to put money behind these decisions and make sure that it's supporting the decisions that are truly supporting the needs of people.
Daniel, how do you see this in terms of you're coming from the private sector, and somehow in the end, the private sector must work together with the public sector and policy. How are you working together? How are you shaping this then together from both the private sector and the public?
Actually, Outcrypt is not a stranger to partnership with the public sectors. Actually, in one of our partnership projects with 2U, Korean social cooperatives, we made the mobility map applications to provide barrier informations for the persons with disabilities. So in that time, the 2U social cooperative defined the requirements for those services, and we implemented our app according to the requirements. And also the information is from the actual users. Each real users pin the barrier on the road, on the maps. So this information is added to our barrier repository. For example, the users' opinions about the slippery or flatness of the road or other barrier informations is collected and analyzed to define the amount of accessibility of the spot. So with these informations, we can allow to some. We can create some routes for the persons with disabilities. They can navigate around barriers in the cities. So these cooperations will have a lot of impacts to improve mobility for the persons with disabilities, and also these informations shared to local government. They can focus on the removing barriers on the road in the transport infrastructures. So this joint effort will have always great impacts to improve the transportation services and accessibilities also.
It's great to hear that you're already working together so closely, because it is a topic that needs to be solved together. And what I would love to ask you now is, if you could, do you have maybe a success story where you can share with us where something opened up for disabilities or needs with respect to accessibility, and what actions were key in order to achieve what you achieved in that scenario?
Gosh, that's a tough one. What's necessary to achieve is to start by talking with people with disabilities. Far too often in transport planning, we hold a public meeting when all the plans are finalized saying, isn't this excellent? And when somebody puts their hand up and says, well, no, because I can't manage to do that, it's too late, it's too expensive, it's too difficult to change. So bringing in people with disabilities from day one to help with the design and planning of any transport development is absolutely essential. I'm now struggling to think of a success story, which is a dreadful indictment, really. There are some examples. If we take the low-floor bus, for example, 20, 30 years ago, they just didn't exist, and then the Dutch had developed them, and I was in the UK government at that time, and I said, we need these, they're great. Oh, no, they work in the Netherlands because there's no hills. They wouldn't work in the UK. They'd hit the ground, nobody wants them. In the end, we borrowed some Dutch buses, brought them to the UK and gave them to operators and said, just run these for a couple of weeks and see what you think. And of course, everybody loved them because they were easier to get in and out of. And they were a fundamental example of universal design. It wasn't designed for wheelchair users or disabled people. It was designed for the vast bulk of people who travel by bus, who include people with baby buggies, older people, people with shopping bags. Everybody gets on and off more easily. So I think the universal success for Europe is that you can no longer buy a bus that is not low floor and accessible. In part, that's come from regulation, but in this case, the regulation followed the innovation of having the vision to see that here was something that would transform the way that people use public transport, including wheelchair users and a lot of other people as well.
I think that's a very good example that you came up with now. Tim, how about from your perspective, working with this international community that you have, what are some actions that you have seen to be effective in implementing better accessibility in one or the other regions?
Yeah, there's a number of pockets, number of examples of increasing accessibility. But I just want to comment on Anne's point. I think part of the problem with the planning process is it is done in a vacuum, as Anne says, and we're not involving the stakeholders, the proper stakeholders, early enough. And we need to convince the decision makers that these are investments that we're making. They're not costs. I mean, if you have a safe and affordable transportation network for all users, it's going to make everything better. I mean, if you look at the costs of, in the US, for example, the US was one of the only countries where traffic deaths, car crashes, injuries, and deaths went up during the pandemic. A lot of those deaths were pedestrians and cyclists because we're not properly integrating those modes of transportation into our networks, and we're just kind of plopping a little stripe on the side of the road as a bike lane and hoping for the best. Whereas, we've seen countries like the Netherlands where they've done proper infrastructure for cyclists. So I think it's incumbent upon us from a federation of like-minded clubs to work with governments to help and to bring the education and the knowledge from the private sector or to them, because they don't always have that experience or that knowledge. In terms of specific examples, I know in my country, Canada, we've set up on the West Coast, we have a car sharing platform. So where it's expensive to own a car, we developed a network of cars of EVs that you can EVs and hybrid vehicles that you can use to get around the city. It's got over 200,000 members now, and what we're doing there is we're taking the costs of parking, the cost of owning a car out of the user's hands, and they just have to pay for the efforts or for the transportation they use. That's a small example. A similar thing has been done in Northern California. I think it's where you are, called GIG. You've probably seen that. There are some good examples. In the Nordic countries, they've done a very good job of integrating, to Anne's point, integrating transportation for all, not just for the traditional rapid transit or user, but ensuring that there's better transportation for all users. And I think it's incumbent upon us to do our due diligence and to spend time working with the local authorities to ensure that the voices of the users are heard, and not just the voices of the accountants or the planners that have a budget in mind and they want to fit everything within a budget. Where if you think more long-term and investing in mobility, I think you'll find the long-term cost will be lower because you'll be more efficient, they'll be safer, they'll be more accessible. And through our network, we can influence change that way. I think that's the best thing we can hope for. Because we have a large body of clubs, we can successfully lobby for these types of things. For example, in Europe, we have an office in Brussels which specifically works with the EU. And because we represent multiple countries and multiple interests, we can perhaps influence change a little bit better than one country or one club. So I think that's our strength, is having those collection of countries, clubs that can perhaps have more influence on the decision making.
Thanks, Tim. I think let's spend the last question before we invite up Hank on the topic of this connection between accessibility and sustainability or decarbonization goals. And I would start again with you, Heather. How does accessibility play a role in decarbonization or sustainability?
Well, I think for me, accessibility is really, again, about making sure that people can get where they want, which means everyone. And so success really means when accessibility is successful, it means that we've really gone to scale and that everybody can get where they need. And that is an equitable transportation system. And so when you think about sustainability, sustainability and equitability really go hand in hand. And I think where we are today, some of the things that we think about most with sustainability is air quality, for sure, but also the challenge of climate change. Last year or a year before, ITDP did a study called the Compact City Scenario Electrified, where we actually looked at what is it going to take to get to our 1.5 degree target to stay within the limits of dangerous climate change. And we looked at that with the lens on electrification. It's really exciting that we now have the option of electrification and can get fossil fuels out of our vehicles. And Tim, you've mentioned it several times, but we really had the big question of, how far can we get on with electrification alone? And what we found is that we cannot meet our 1.5 degree goals with electrification alone, that we absolutely need the fundamentals of developing our cities with compact land use planning so that our cities are not sprawling out, but they remain dense and compact, and that they're built on the backbone, again, of accessible transportation, a combination of public transportation, walking, and cycling. Essentially, we need to minimize the number of vehicles on the road and electrify the rest. We also can't get there by just focusing on compact city development, public transportation, and walking and cycling. The two really work hand in hand, and they work hand in hand in terms of the transportation system, but also other systems. If we minimize the number of electric vehicles, that also minimizes the burden on our energy systems, which we know it's a great challenge to make our electricity systems green. So all of these things really work hand in hand if we want to have a sustainable transportation transportation system, it really needs to be one that truly works for everyone and is accessible. So they're really kind of synonymous. And again, accessibility is only is successful if it's at scale, which means that it truly works for everyone.
And I want to come to you because I think we actually had a short dialogue about how sustainability can sometimes be in conflict with accessibility, especially when it comes to maybe more radical ideas of car-free cities or things that go to that extent. And how do you see this, and how can we find a balanced approach to that?
Thank you. It's true, I think, that there is such an emphasis for all sorts of very clear and good and obvious reasons on sustainability and the need to reduce carbon and so on, that agenda tends to take priority, certainly in the minds of transport planners, over other considerations. And what that leads to is decisions, policies, practices that actually reduce the mobility of older and disabled people because they can no longer move about with confidence or with safety. Just to give one or two examples, in the UK, there are a lot now of low traffic neighbourhoods where vehicle access has been severely reduced to residential areas to encourage everybody to cycle and to walk. But it also means that those disabled and older people who are still dependent on their car, and for some people that will be always the only option, are no longer able to get where they need to get. So we're excluding those people from the benefits that they need. Another example would be e-bikes, e-scooters. I noticed on the tables outside a leaflet for one of the e-bike companies with a big headline, mobility is a human right. Absolutely, but that doesn't mean that having an e-bike and frightening the life out of older and disabled people is somebody's human right, because it's taking away somebody else's human right. And the proliferation of e-scooters in particular in many cities, with the claim, and I probably very controversially here, but I actually query whether they do much to reduce car use. I think they probably take people out of public transport, but what they do is frighten people, a lot of people with low vision, with hearing impairment, with slow movement. They are very frightened of being run into. There have been fatalities across every city in Europe, and I'm sure beyond that. And again, you don't see the accident numbers that I think would be there if it wasn't that people actually are too frightened to go out into their neighborhoods. Quite apart from the people riding them, they then drop them across the pavement and they become a tripping hazard. So, you know, they are there, and so many city councils are authorizing them, legalizing them as part of the green agenda, when actually they're reducing the mobility of a substantial part of the population. So I think we need to be very careful about how we weigh up these priorities. I mentioned cycling earlier, and that's, you know, the cycling lobby has a very, very strong and powerful voice. And the need to protect cyclists from traffic is absolutely correct. But one particularly appalling solution, in my view, is something called the floating bus stop, where between the bus stop and where the bus can pull up is a cycle lane. So the person waiting for the bus has to cross that cycle lane to get on the bus. Now, if they can't see, they can't hear, they can't move quickly, what's going to happen? You know, to my mind, that is an appalling way to address the need both to protect and promote cycling, but also, well, you know, what happened to the need to protect people who can't cycle, who do rely on public transport, but are now not able to get across this cycle lane to get to where they need to be. So we risk being so caught up in the green agenda that we actually forget that it can be very damaging to lots of people. Not to say we need to abandon it, of course not, but we need to stop and think at every point. And what I said a while back was we need to engage with people right from the outset if we were to introduce this cycle lane that cuts between a bus stop and the bus, would that be okay to you as a blind person? You know, if they'd had that kind of dialogue at the beginning, we wouldn't have the very frightening scenario that we now have in many cities. So I think it's an alarm bell that's ringing quite loudly that we need to be very aware of.
Let's go to you, Daniel. What role does new technology in this data play in connecting the sustainability goals with accessibility?
Yeah. I'm sure the electrification is one of the most powerful methods, but it can be enough to solve the energy or environmental problems, as Heather mentioned earlier. So other than adopting the electric vehicles, we can consider several other technologies. In my opinion, one of the most prominent and significant methods is intelligent transport systems. Usually we call it ITS. ITS can solve the traffic flow and traffic accident problems, also to improve the efficiency of traffic transport systems. For example, a single discoordination on the road can slow down the whole lanes and hold the lanes. This discoordination can be solved by sharing the informations around and the driver's intentions and other infrastructure informations also. So ITS system, the key point of ITS system is sharing the traffic informations from between the vehicle and vehicle to pedestrian and infrastructures. So, and usually ITS system uses VTX technology, vehicle to everything communication technologies. VTX technology can be a great tools to improve the sustainability and all accessibility to prevent the accident and improve the safety also. Yeah, thank you.
Tim, maybe let's wrap up with you and how you see this topic of the linkages between sustainability and accessibility.
Yeah, as we've all discussed, I mean, they're linked completely in terms of providing safe access to all and providing us, a greener environment. If I look specifically at the sustainability side of it, you mentioned carbon in your opening remarks, I've seen a couple of examples where there are obvious solutions, but it would take a lot of political will and a lot of lobbying to solve them. For example, I went to the vehicle assessment center that's run by the ADAC, which is the German auto club. They have over 20 million members, and they do crash testing and pollution control for vehicles, specifically for the EU, but also they test vehicles from other parts of the world. And one thing I was shown was, describe it as a sponge. And if you ran an EU vehicle, new vehicle, and put this on the exhaust, the sponge would remain white, let's say. If you took the same vehicle that's being sold maybe in South America and put that sponge on the exhaust, it's brown, which means that the regulations in that part of the world are not as strong as the regulations in Europe. And on top of that, when we talk about EVs, when you take an EV, sell an EV in Europe, for example, that car isn't thrown away. It's typically sold to someone in another part of the world. So I don't think EVs are the immediate solution. I think there are other things. I think if we lobbied governments to increase the regulation on fossil fuel vehicles, I think we'd probably have a greater impact on the environment than we will with EVs, at least in the near future. And I think, to Anne's point about accessibility, and Heather, we can't just talk about improving public transit, improving cycling lanes without looking at the full picture. And I think, as we've talked about earlier, we need to involve these various groups in the decision-making process. I mean, we are guilty in our world of having a lot of people on boards that kind of look like me, that are not representative of the population, and we need to bring younger people into these boards. We need to bring people with disabilities into these governing bodies, because we need to help lobby the governments for change. Because the governments aren't going to change unless they get pressure. And I think using our network, we can do that. We can encourage more diversity in the decision-making and policy-making agenda. So, I think having more accessibility, access to all, will inherently create a more sustainable environment, because people are going to be able to get about their daily lives in a safe, secure way without being disadvantaged or frightened to embark on the new flavor of the day transportation system.
Okay, thank you. I want to switch gears. It's really a pleasure that we have Henk Stipdonk here from KIM, the Netherlands Institute for Transport Policy Analysis. And what's great about having his intervention today is that he is bringing in some insights from the research session that was held on this topic previously. And I think it's important now that we have the chance to connect some of the research with this discussion that we've just been having on actions, policy, investments, and bring it full circle. So I hand it over to you now, Henk.
Thank you, Jennifer. Yes, zipping research into policymaking, that's what we do at KIM in the Netherlands with the Ministry of Traffic, Transport and Infrastructure. Also regarding accessibility. As you have noticed from the discussion we had, accessibility can have many faces. It can be on disabled persons, or it can be on building cycling lanes, like we just heard. I would like to tell you something about what we did in the Netherlands regarding accessibility as a general principle of improving the way people travel from one place to another, which of course you do by train or car or cycling. But what you actually do is you want to be somewhere else and you go there. And in the Netherlands, what happened is because we have a climate issue, we realized, the ministry realized, that you cannot solve the climate problems and at the same time continue facilitating more and more car travel or truck travel or any travel because people want to live further away from their job or have to travel further to another hospital because the hospital close by was closed by the Ministry of Health without thinking about the extra traffic. So it's about the Netherlands. In the Netherlands, the Ministry of Infrastructure decided it's about time not to accept that the infrastructure and travel is always the last thing that has to be solved with extra roads. So they decided to listen to the ITF report that said you should switch, if you want to solve the problems in the long run, you should switch from the paradigm predict travel times and provide more roads toward decide where you want to go with traffic and transport and then provide this new route. Now, if you switch from calculating extra travel times to accessibility as a general way to allow for people to reach their destiny, you need another way to calculate the value of accessibility. You can't just calculate the value of the travel of time. That's difficult. So the Ministry of of Transport asked us to think along, because they wanted to write a new vision, a long-term vision for 2050 on mobility and actually on accessibility. And, well, they didn't know how to do that, because what is accessibility? It can be so many things. Would it always require a car or a motor vehicle? Or should you define accessibility as a reasonable travel time towards your job? Or not just your job, but also the school of your children, or the hospital, or the doctor, or a shopping center? And what would be acceptable travel times to go to a doctor, or to your job, and so on and so forth? And should these travel times be by car, or by bicycle, or by public transport? And then we have an increasing urbanization all over the world, and also in the Netherlands. More and more people in cities. We want to build dense cities, but the more people there are in the city, the less room there is for a car. It's a logical thing, you can't have both. So how to do that? Do we want the 15-minute city, and then traveling by foot or by cycle or by public transport as a general way of traveling, with a car being an exception? All these things were unknown. So what they did, let me see, what we did was cooperate with the ministry and think, what were their needs, what would they like to decide, what did they know what to decide. And then we said, well, okay, how can you derive a new mobility policy taking care of these accessibility notions? So what we did was, actually we sat together on a day-to-day basis for a couple of years. We started, I think, in 2021 with this, or even earlier, I don't remember. And it ended with a document that was sent to the Parliament in March, explaining what we had in mind, what the ministry had in mind, and what accessibility could be or should be. We were thinking about how to define accessibility with different variants. We thought about how to monitor accessibility. And in the end, you also need to think about how to value it, because if you can't calculate the cost-benefit based on less travel time losses, and you have instead to value accessibility, how do you do that? So we need a precise indicator telling us what accessibility is worth. And we need targets to know where to head for as a ministry. Now, the role of KIM is to provide options. KIM is my research institute. So we provided options. We provided facts and possibilities. And it was up to the ministry to make choices, to decide which direction. Because it's always important, if you're working together as a researcher with a policymaker, to make sure that the positions remain as they should be. So the researcher is not responsible for the choices, and the policymaker is not responsible for the facts. We do the facts, and the policymaker makes the choices. And I think it worked well. Let me see, have I forgotten anything? Yeah, I forgot what we discussed yesterday morning. Was yesterday morning in another session, in a spotlight session on research, which was very interesting. Some of you may have been there. We also discussed this, so some of what I just said was also marked there. But one final thing is, if you think about accessibility, you need to think how to optimize. You can optimize in several ways, and it depends on how you define equity. Do you just accept the total accessibility to be optimized, or do you also take care of differences in accessibility? Do you like to diminish the the differences as much as possible. Like the example that Anne just mentioned, when we have buses in the Netherlands, everyone can step on the bus, whether abled or disabled. Well, there are of course always limits, but it's much easier nowadays. So you can solve problems by taking away differences sometimes. That's also an important issue. And of course, you can also think about sufficientarianism options where you say, well, there can be differences, but at least we will provide minimum accessibility values for everyone. So everyone should be able to go to a bus station within a 5-minute walk. It could be criteria like that. These things and other options are all discussed in this paper for the Parliament. And I think it worked well. We're on the track. We'll see where it gets us, but I have good hopes.
Thank you very much, Henk. We have actually a very special guest who just came in, so we'd like to welcome Kees van der Burg, the Vice President at the Ministry of Infrastructure and Water Management. Jaroslav, I think, is getting you a microphone, or yes. And we would love to capture your insights and your impulse here on the topic of accessibility.
Okay, thank you, and good to be here. Well, everything Henk told is true, so that's the first thing I have to say. So, I think we started in the ministry, and Henk said in 2021, about thinking about the question of our mobility system was future-proof. I think that's the main question for me, because with all the limitations when it comes to the growth, the population, environmental issues, the density of the cities in the Netherlands, can we deliver the same mobility to my kids, to the next generation that we have now? So that for me was the main trigger to think about the future-proof of our system. I worked for the Ministry of Healthcare for 17 years, and in the healthcare sector, it's very common to think about quality, cost, and accessibility. It's the 3 pillars of a system. And when I started at the Ministry of Infrastructure, we were always talking about the quality of the system, but we never discussed the accessibility of the system. It was not an issue at the ministry. So I think we started the discussion 3-4 years ago, actually inspired by the Global Transport Outlook of the ITF. So the ITF put this theme on the agenda. And it's not, just like Henk mentioned, it's not only accessibility of access to the modalities, but also more fundamental, the access to goods and services and jobs. So that's, and especially in the Netherlands, with a very dense population in the western side and a less dense population in the eastern side, we got a problem when it comes to the idea that mobility in a system is there for everybody. So the right for mobility for everybody, that's high on the political agenda in the Netherlands right now. So maybe to elaborate on this a bit more, when it comes to, so we're not talking about mobility, we're talking about accessibility. That's the issue. And accessibility is the sum of spatial planning. It's the sum of spatial planning and the issues, where do you plan facilities, hospitals, working conditions, etc. And then there is mobility, and mobility is not the same as infrastructure. So that's basically the idea of our new mobility vision. So, and that also makes clear that as a Ministry of Infrastructure, we're not the only one who can strive for our goals when it comes to accessibility. We need other ministries, we need local governments, we need all kinds of private partners. So that's basically the idea of the new mobility vision, again inspired by the ITF. And then when it comes to the collaboration between the KIM and the ministry, well, I also worked at the Ministry of Finance, and there was this saying, well, is this policy or is it thoroughly thinking? And I'm very fond of fact-based politics. I think when I entered the ministry, well, it was a gift that there was something like Kim. Because they can distinguish opinions from facts. And of course, it's for politicians to have an opinion about that. That's their job, to have an opinion. But it's my job to have facts. And so working fact-based is very important. And actually, Kim and the policy part of the ministry, they work closely together. But like Henk stated, the Kim is about the facts and what is real. And for me, it's the job to create policy based on facts for the politicians. And Kim has always been very strict, and it was never said we are responsible for the policy, you're responsible for the policy, we're responsible for the facts, and we work very closely together. And the discussions we have are very political, but we never argued about changes of role, etc. So I think policy and knowledge institutions working together on long-term visions, well, for me it worked perfectly, and I thank the Kim for all their good work.
Wonderful. I think it's really helpful to have those two standpoints together and an example of...
Maybe it helps. I worked at the Ministry of Finance, I thought, too, and I was responsible for all kinds of methodology for ex-ante evaluations, multi-criteria evaluations. So the idea of it's our job. It's our job to facilitate politicians with fact-based politics. So
we would have a little bit of time now for some questions from the audience. So I think we have some microphones out there, and if there's some questions that you'd like to ask our panelists, I'm sure they would be glad to answer.
Hi, thank you to the panel for a really thoughtful discussion. I think this was the most interesting session I've attended so far. I'm from a company called Synapse. We're a UK technology company. We're focused on deaf accessibility. So what we're doing in the transport space is making passenger information available in sign language, which is a first, because typically that's a group that is completely ignored when it comes to transport planning. And we have a lot of conversations which go something like, well, why can't deaf people just read? So my question, I think particularly to Heather and to Anne, because you touched on this, is how can we make transport stakeholders understand the value of making their services accessible to a group like that whose needs they are otherwise ignoring?
Shall I start? Well, I think it's fantastic that your organization exists to really look out for those needs. And I would say I don't have any direct experience in looking out for people that are deaf. So I can't provide any real information other than to say, again, I think we need to be putting ourselves in the shoes of those folks and understanding what the needs are and designing around them. So it really is fantastic to hear that there is an organization like yours out there that are doing that. And I'm afraid I can't add any more specifics than some of the generalities that I've already said. But yeah, I think, again, making sure especially that we're thinking about the needs and planning, and that we're dedicating budget to make sure that happens.
Add to that, I mean, your point that everybody assumes that deaf people can read is a classic example of not actually understanding the underlying issues. And I think for a long time that's been the barrier that you need to overcome. I've actually been working with your colleagues to try and get you into London Gatwick to introduce the real live capacity that you have to communicate in sign language with those deaf people who may be prelingually deaf and therefore unable to read. It may not be a huge majority, but it's a very important subsection of the travelling public who've absolutely been ignored until now. So I think it's great that the technology is now there, and I'm delighted that you're here. I know you're also on the UK presidency stand, so if I can put in a small plug to everybody to go and talk to the Synapse colleagues there, because it's a fabulous bit of technology. And I would certainly say that every station on-vehicle facility, every airport, should be looking at how to communicate effectively with everybody in the population, not just those that have traditionally been top of their minds.
Please, Tim.
Yeah, that's a great point. And just a related observation, and I've talked about EVs a lot, and I apologize for that, but there's been lobby groups in the US that say EVs are dangerous because you can't hear them coming, right? Because there's and that makes you think about what it would be like for a deaf person that can't hear a bus coming, let alone an EV. So I think, maybe that will raise some insights or some thoughts around transportation mobility planning.
I think we had one more question here, if we can do that one, and then I think we're nearly out of time.
Yes, my name is Christophe Andrier. I have a question, I would call it acceptability. So we talked about sustainability and access, and then you talked about your finance minister. And then the question is, what do we accept? And here we need to put the opinions away from the facts, maybe, find something, because for the opinion, everyone is the most important, probably. But the question is, what do we want to accept, and how do we measure our tolerance, or I don't know, our inclusiveness? Yes. So we want to include many people, but where do we take the border? What is acceptable? What is not acceptable? I think this is also a burden that can be discussed. But maybe you can elaborate on that shortly.
Thank you. I think it's a very important point. Just one perspective, I think, is to remember that those that we decide we can't include for whatever reason don't just disappear. Their costs fall on some other part of society. So, for example, if older people are no longer able to be independently mobile, doesn't bother the transport system, but there's an immediate cost on the health and welfare systems, because you have to bring care into the home, which is probably actually less good than if they'd been able to go out to see their doctor or go to a hospital appointment. Their nutritional levels suffer because they are relying on somebody else to buy their basic food. So, there is a major health and well-being implication and a major economic implication for not addressing accessibility. So, to my mind, that's a key part of the balance. If we say we can't afford to do something, are we looking at it just through the silo of a transport budget, where in fact we're just shifting the cost off to another part of the economy, to the health or the welfare budget? So those are the kind of balances that I think need to be taken on board.
Anybody else want to make a comment? Yep.
Yes, very good answer. But in general, this is a political issue, of course, in the end. It's the same with road safety. We accept no road deaths and serious injuries on our roads. We want this to be zero. But then you can't achieve that from overnight. So what we do is strive and put our money where we think it's best spent. And sometimes it's increasing the mobility of disabled, and sometimes it's improving the road safety of cyclists, and sometimes it's not closing a hospital because it would generate too much travel. But it's political, that's for one, and two, it's not unique for accessibility, this question you ask.
I think it's a really good question, and I don't have an answer specifically on what is acceptable. a lot of the conversation so far has focused on Europe and the North. And so I just want to kind of bring it back to a lot of what ITDP is focused on, which is the rest of the world, where our systems currently being designed, I would just say, are not acceptable because, again, so many of them are designed around predominantly vehicles moving quickly. As we've touched upon earlier, most of those vehicles are used vehicles with dirty fuels that are, causing air pollution, making people sick, on streets that are designed poorly, so leading to fatalities and injuries on the road. So I don't have an answer exactly for what is acceptable, other than to say that we are so far from it in most of the places in the world, and that if we get to a place where we're really thinking about that question at the level that I think some of the others have answered, we'll be in such a better place than we are right now. So just wanted to bring it back to, I think the majority of the people in the world and the perspectives that we're dealing with there.
Perfect. Thank you for that perspective. Actually, I think that's quite important. So we will just end the session in just a moment. What I'd like to do is I'd like to actually ask the panelists to just give one takeaway. I mean, one sentence or one word, but just very quickly on the spot, what do you want all of the people here that were listening today to just take away from this topic? And I would start with you, Heather.
Sure, I would say if our transportation systems are truly successful, that means that they are operating at scale, which means that they are serving the needs of all people, which means that they are truly accessible, and that's what we should be striving for.
Sharing information is the key point, the key tools to improve our transportation and accessibilities. Yeah, sharing the data. Yeah.
Engage with disabled and older people at the start of the planning process, not at the end.
In a FIA, we talk about mobility for all, but I think we need to ensure when we say that we are talking about all, including people with disabilities.
Just make a first step and make sure it's on solid ground.
Thank you. And I want to thank you all very much for being here, for your contribution, your expertise, and all of the insights that you shared today. And thank all of you for your attention today, and wish you a wonderful day, the rest of your day at ITF.